Most men believe that once they pass 60, stopping sexual activity simply doesn't matter anymore. But what if I told you the science says otherwise? And what if understanding this could change how you age, how you feel, and how long you stay vital? What really happens to your body when you completely stop having sex after 60? Does it affect your health, or is it perfectly harmless to assume this chapter of life is simply over? Many men quietly accept sexual inactivity as an unavoidable part of aging, but modern research paints a very different picture. The science behind sexual activity, health, and longevity challenges long-held beliefs about what aging truly means for the male body. I'm Dr. Lina, a urologist, and for more than a decade I've studied how sexual health connects to overall wellness in older men. What I'm sharing today is not opinion, fear, or pressure. It's evidence-based information that helps you understand how your body responds when sexual activity stops and why this knowledge matters. Before we go further, let me be absolutely clear. This conversation is not about performance, expectations, or judgment. It's not about forcing anyone to do something they don't want to do. Many men are sexually inactive by choice, circumstance, or health challenges, and none of those define your value. What matters is having accurate information so your choices are informed rather than based on outdated assumptions. Sexual activity is often dismissed as purely recreational, but research consistently shows it is connected to cardiovascular health, hormone regulation, immune function, mental well-being, cognitive performance, and even mortality risk. Regular sexual activity, whether partnered or solo, sends powerful biological signals throughout the body that support long-term health. Today, I'm going to walk you through 5 specific areas where science shows sexual activity has measurable effects. I'll explain what happens biologically when activity stops, what that means for your health, and what options exist if you don't have a partner or experience physical limitations. By the end, you'll have a clear understanding of how sexual health fits into aging well. Let's begin with the 5th area: cardiovascular health and mortality risk. This is often the most surprising finding for men. Multiple long-term studies have found strong associations between sexual frequency and heart health. A landmark study published in the American Journal of Cardiology followed men for decades and found that those who had sex 2 or more times per week had a significantly lower risk of fatal heart attacks compared to men who had sex less than once per month. Another large population study published in the Journal of Epidemiology found that men who remained sexually active into their 70s and 80s had lower all-cause mortality rates. In simple terms, sexually active men tended to live longer. Here's why. Sexual activity functions as moderate cardiovascular exercise. It raises heart rate, improves blood circulation, and keeps blood vessels responsive. Additionally, sexual activity triggers the release of oxytocin and endorphins, hormones that reduce stress, lower blood pressure, and support heart health. Emotionally, sexual vitality often reinforces overall vitality, helping men feel more engaged in life. Practically, this does not mean daily sex is required. Research suggests that 1 to 2 times per week provides measurable cardiovascular benefit. The key takeaway is that sexual activity supports heart health and is associated with lower mortality risk. Now let's move to number 4, testosterone and hormonal health. Sexual activity plays a critical role in maintaining hormonal feedback loops in the body. When men remain sexually active, the brain receives signals that these systems are still needed, which supports ongoing testosterone production. When sexual activity stops completely, those signals weaken. Over time, this can contribute to declining testosterone levels. Studies show that men who maintain regular sexual activity tend to have higher testosterone levels than men who are completely inactive at the same age. There's an important nuance here. The relationship between testosterone and sexual activity is bidirectional. Low testosterone reduces desire and function, but low sexual activity can also accelerate testosterone decline. This creates a feedback loop. Activity supports hormones, and hormones support activity. Inactivity often leads to further decline. Testosterone affects energy, mood, motivation, muscle mass, and overall sense of vitality. Supporting testosterone through regular sexual activity helps maintain these aspects of well-being. The key takeaway is that regular sexual activity supports healthier testosterone levels through hormonal feedback mechanisms. Number 3 is prostate health. This is one of the most consistently supported findings in urology research. Multiple large-scale studies, including research published in JAMA and European Urology, show that men who ejaculate more frequently have significantly lower rates of prostate cancer compared to men with lower ejaculation frequency. The biological explanation is straightforward. Ejaculation helps flush the prostate of inflammatory substances, reduces congestion, and supports healthy gland function. When men stop all sexual activity, this protective flushing mechanism stops. This does not mean that stopping sexual activity causes prostate cancer, as many factors influence risk. However, it does mean that regular ejaculation provides a measurable protective benefit. Importantly, this benefit applies to both partnered and solo activity. The prostate responds to ejaculation itself, not the context. Research suggests that 2 to 3 times per week provides meaningful prostate health support. The key takeaway is that regular ejaculation supports prostate health and lowers prostate cancer risk. Number 2 is mental health and cognitive function. Sexual activity has powerful effects on the brain. During sexual activity, the body releases dopamine, oxytocin, serotonin, and endorphins. These neurochemicals improve mood, reduce anxiety and depression, support emotional bonding, and enhance overall psychological well-being. Studies show that sexually active older adults report lower rates of depression, higher life satisfaction, and better overall mental health. Research published in the Journals of Gerontology found that older adults who remained sexually active performed better on cognitive tests than those who were inactive. The biological mechanisms likely include neurochemical release, improved blood flow to the brain, reduced stress hormones, and the psychological benefits of feeling engaged and capable. Emotionally, sexual activity reinforces the sense that you are still involved in life, still connected, and still vital. Complete withdrawal from sexual activity can sometimes contribute to feelings of decline, disengagement, or loss of identity. Practically, maintaining sexual activity in whatever form works for you supports mental health and may help protect cognitive function. The key takeaway is that sexual activity supports mood, mental health, and possibly cognitive performance. Number 1 is physical function and tissue health. This is the most direct physical consequence of sexual inactivity. Penile tissue depends on regular oxygen-rich blood flow to remain healthy. Erections, whether during sex, solo activity, or nocturnal erections during sleep, deliver that oxygen and maintain tissue elasticity. When men stop all sexual activity completely, and especially if nocturnal erections are reduced due to sleep issues, medications, or health conditions, tissue oxygenation decreases. Over time, this can lead to reduced elasticity, mild fibrosis, and greater difficulty achieving erections when desired. Studies using ultrasound imaging show measurable tissue changes in men who are completely inactive for extended periods. This does not mean function is permanently lost, but restoration often requires more effort, including medications, vacuum devices, or other therapies. Regular activity 2 to 3 times per week helps preserve tissue health and function. The key takeaway is that sexual activity maintains tissue health, while complete inactivity can make future restoration more difficult. Now, let's address the most important question. What if you don't have a partner, or what if physical function is difficult? This is critical information. The health benefits we've discussed apply equally to partnered and solo activity. Your body does not distinguish between them. The cardiovascular, hormonal, prostate, mental, and tissue benefits are the same. If physical function is difficult, there are effective options. Medications such as sildenafil or tadalafil can support erections. Vacuum devices can maintain blood flow. Addressing cardiovascular health, hormone levels, sleep quality, and medication side effects can significantly improve baseline function. The key is not giving up completely. Even imperfect activity provides biological benefit. I have patients in their 70s and 80s who maintain regular solo activities specifically for health maintenance. They understand it is not just about pleasure, but about preserving vitality. Now, let me be clear about what this research does not mean. It does not mean that men who are sexually inactive will inevitably have poor health. Sexual activity is only one piece of overall wellness. It does not mean you should feel pressured if you genuinely do not want to be sexually active. Autonomy and quality of life matter. What it does mean is that sexual activity provides measurable health benefits, and you deserve to know that when making decisions about your body. Information empowers choice. Here is your practical action plan. If you are currently sexually active, continue. Aim for 2 to 3 times per week for optimal health support. If you have become inactive and want to resume, address underlying health factors such as cardiovascular fitness, hormones, medications, and mental health. Use medical support if needed and start gradually without pressure. Remember that solo activity provides the same biological benefits as partnered activity. If you choose inactivity, that is your decision, but make it informed. Regardless of your choice, prioritize sleep, exercise, mental health, and overall cardiovascular wellness. This information is not about judgment, it is about empowerment. Aging does not mean giving up. It means adapting intelligently and staying engaged in every aspect of health, including sexual health. You deserve to feel vital, informed, and in control of your well-being. If this video gave you new insight into how sexual activity affects health after 60, share it with someone who needs to hear this information. And if you want continued science-based guidance that helps you age with strength, clarity, and confidence, subscribe to this channel. I'm Dr. Lina, and I'm here to help you make informed decisions that support long-term health, vitality, and quality of life.